Hi everybody, Dr. Adam Mead here, and today I want to talk to you about something we use with every single patient that goes through our weight loss programs and looks to transform their health. It's our body composition scale. Now, a lot of people think the only number that matters is the one on the scale, but the truth is that number doesn't tell the whole story about your health. You can have two people that say weigh 180 pounds, one is healthy, strong, and super energized, while the other one is tired all the time. They're super inflamed and they're struggling with their metabolism. What's the difference? It lies in their body's composition. When we start a weight loss journey, our goal isn't just to lose weight, it's to lose fat, preserve or build muscle, stay hydrated, and improve metabolism. That combination of fat loss, muscle retention, hydration, and metabolic health is what creates lasting results. And that's really what the scale is measuring for us. It gives us insight to 5 key areas: body fat percentage, muscle mass, water balance, visceral fat, and metabolic age. So let's break down each of these, because once you understand what they mean, you'll understand why this test is powerful and really part of your transformation. Body fat percentage tells us how much of your total body weight is fat. Now, some fat is necessary. Your body needs fat for hormone balance, organ protection, and temperature regulation. But when fat levels get too high, especially around the belly and organs, that's when inflammation starts. Your energy levels drop and your risk of chronic issues such as heart disease, cancer, and diabetes, they start to go up. So when we measure fat percentage, we're not just chasing numbers or looking for changes in how our body appears, we're tracking how healthy and efficient your body is actually becoming. When someone's fat percentage drops, say, from 35 to 28%, that's not just weight loss, that's a stronger metabolism, better energy, less joint pain, and improved confidence. That's real progress overall. Next up, let's look at muscle mass. This is one of the most important numbers we look at, and one of the most numbers that people don't think about when they're losing weight. Muscle isn't just about strength or appearance, it's your metabolic engine. The more lean muscle you have, the more calories and fat your body burns, even when you're just sitting and resting. So when you lose weight, we want to make sure you're losing fat, not muscle. That's why so many fad diets fail. People lose both fat and muscle in the process, the metabolism slows down, and the weight, it comes right back. When your scale shows muscle holding and steadily as fat is dropping, this is why we know and how we know your body is getting leaner and healthier the right way. And that's why as you go through our program, we often encourage gentle resistance training, such as body weight movements and walking. This helps preserve that lean tissue. Muscle keeps you young, it keeps you strong, and it keeps those lasting results. Next, let's look at water balance. Your body is made up to over 70% water. So here's what surprises a lot of people. Being dehydrated just doesn't make you thirsty, it actually makes it harder for you to lose weight. When your body doesn't have enough water, your metabolism actually slows down. Toxins, they begin to build, and stress hormones cause your body to hold on to more water. The scale helps us track your total body water percentage, so we can see if hydration or water retention is affecting your results. Sometimes when the scale stalls for a couple weeks, it's not just fat gain, it's water fluctuations from inflammation, sodium, or even stress. That's why we always remind patients to hydrate well, to eat foods rich in water like vegetables and fruit, and support that natural balance with electrolytes. Proper hydration means better energy, better recovery, and better fat metabolism. Now this one might be the most important. That's visceral fat. Visceral fat is that deep fat that wraps around your internal organs like your heart, your liver, and your intestines. Unlike the fat you can pinch under your skin, visceral fat is active. It releases inflammatory chemicals and hormones that raise blood pressure, increase insulin resistance, and your risk for heart disease and cancer. Here's the thing, you can look a normal weight overall, but still have high visceral fat. That's why this number matters so much. It tells us about your internal health, not just what you see in the mirror. As you go through our program and that visceral fat, it starts to drop, you'll often notice huge changes, better energy, better sleep, better digestion, even clearer thinking. That's your body coming back into balance. And that's one of the most rewarding changes we see week in and week out when you're on a weight loss system or a weight loss program overall. And finally, your metabolic age. This one always gets people's attention. Metabolic age, it compares how efficient your body burns energy for what your typical age actually is. So if you're 45 years old and your scale shows a metabolic age of 55, that means your metabolism is slower than it should be. But when you start improving your body composition, you're lowering your fat, building muscle, improving hydration, that number can drop dramatically. We've seen patients lower their metabolic age by 10 to even 15 years. That means your body is functioning younger, stronger, and healthier. It's a visual proof that you're not just doing what it takes to lose weight, but you're truly reversing your biological clock. It's about changing your overall health, not just your appearance. So when we review your body composition scan, we're not just checking the numbers, we're watching your body's story unfold. A story of your metabolic age waking up, your inflammation going down, your energy levels starting to come back, and your body actually becoming a healthier version of itself. That's why this test is so important and so powerful. It helps us personalize your program, celebrate your wins, and make smart adjustments along the way. If you haven't had your body composition test yet, make sure you stop by the front desk, mention it to me, and we can schedule it for you on one of your upcoming visits. It only takes a few minutes and it's completely painless, and it gives you and us a great insight to your overall health. Remember, the regular scale only tells part of the story, but your body composition tells us the truth about your health and your progress. Once again, I'm Dr. Adam Mead. We look forward to helping you achieve your goals and see you improve your body composition and change your health for the future. See you soon.